On today's cover story, electroshock therapy, once seen as an outdated, even barbaric procedure, is now seeing a bit of a resurgence. NBC's Mara Scavacampo has more. Mara, good morning.
Matt, good morning. Well, today it's called Electroconvulsive therapy, or ECT for short. You may be surprised to learn that an estimated 100,000 Americans undergo the procedure every year. And for many, the experience is much different than what you might think. These are the images often associated with electroshock therapy, portrayed by Hollywood as painful, violent, and archaic. But for Denise Stewart, the experience was life-saving.
There would be voices in my head that would sit there and say, Denise, see the knife in the kitchen? Cut your wrist. Denise, see those pills over there? Take all those pills.
When antidepressants only made her condition worse, her doctors turned to ECT.
If it hadn't been for the electroconvulsive therapy, I wouldn't be alive right now.
And she's not alone. Stories like Denise's are helping ease the stigma from ECT, transforming it into a widely accepted treatment for mental illnesses like depression and bipolar disorders.
ECT is now being recognized as an effective treatment as opposed to something that's barbaric, invasive, and potentially has damaging effects to patients.
Just last week, Simon Winchester, author of The Man with the Electrified Brain, spoke out on our show about his own ECT experience.
Electroconvulsive therapy, stigmatized though it may be, actually for some cases, and I'm a classic example, really does work.
Today, an ECT treatment typically involves a series of sessions lasting a few seconds each. Patients are sedated and don't feel a thing, and doctors say it's sometimes more effective than antidepressant medications.
70 to 80% of people will respond favorably, and in some cases they will have a complete remission of symptoms.
But there are negative side effects, such as memory loss, something Stewart admits struggling with. Still, she says the therapy has brought her and her family a sense of hope.
I'm showing my kids the way life should be. I'm showing them that there is recovery from mental illness. Life is much better. I have life now. I didn't have life before.
ECT is backed by the American Psychiatric Association, the American Medical Association, and the Surgeon General. And experts also say that for some patients, it can be the difference between being institutionalized and leading a normal life. Matt?
All right, Mara, thank you very much. Dr. Nancy Snyderman is NBC's chief medical editor. Nancy, good morning to you. You know there are people who just watch that who say, okay, it's effective, it can be life-changing, but I still can't get past the stigma.
We can't get past the stigma of all the visuals we've seen from movies and the fact that it seems so antiquated when you consider modern medicine. But time and time and time again, if you look at patients who have severe depression, who don't respond to medications, they will tell you that ECT works. This is not something that institutionalized medicine like the American Medical Association is keeping in just to dig its heels in. They're saying, the AMA says, it works, it's safe, therefore we should still do it.
But is it a one-time thing, or do patients have to keep going back?
Depends. Most patients will have a series of a few, and they'll see then how they do. But Mara pointed to the most important thing is the short-term memory loss is real. Some people will really have that.
But you will regain the memory?
Sometimes yes, sometimes no. You're not going to lose the memory of who you are and what you've done in life, but you may forget what you had for dinner last night. That's short-term memory.
That can be a real major side effect for a lot of people.
But then you have your day's activities that come and replenish it. So yes, I get it. There's nothing that we give people in the psychiatric world that doesn't have a side effect, and the powerful medications included.
Forget the diagnosis for a second. You say it works with bipolar and depression. What about the patient in terms of age, gender? Does that matter?
Well, increasingly, we've started looking at pre-adolescents, adolescents. For years, it was just adults. But as we've tried to figure out obsessive-compulsive disorder, bipolar, and severe depression, when medications don't work, you and I have talked about medicinal marijuana in the past, other things, I think the whole body of medicine has to be stretched. I'm not pro-ECT. I'm pro-using things correctly when nothing else works.
In specific circumstances.
Yeah, I think doctors will always try medication and therapy first. But if it means institutionalizing someone versus sending them back to having a real life, yes.
But your point is this is more of a last resort.
Yeah, well, it's never a first-line resort. But does it work? The answer is yes.
Nancy
I've seen it work.
Thanks so much.
You bet, Matt.
Appreciate it.